Question 1. A patient in septic shock is receiving norepinephrine. Which finding requires immediate action by the nurse? A. Blood pressure increased from 80 over 50 millimeters of mercury to 95 over 60 millimeters of mercury. B. Urine output is 25 milliliters per hour. C. Skin around the IV site is cold and pale. D. Heart rate is 98 beats per minute. Answer. C. Skin around the IV site is cold and pale. Question 2. Which patient should the nurse assess first during a shift change on a shock unit? A. A post-operative patient with a blood pressure of 100 over 60 millimeters of mercury and heart rate 90. B. A patient in hypovolemic shock with newly modeled extremities. C. A stable patient with distributive shock receiving IV fluids. D. A patient with cardiogenic shock who has an oxygen saturation of 94%. Answer. B. A patient in hypovolemic shock with newly modeled extremities. Question 3. A nurse is caring for a patient in cardiogenic shock. What is the priority action? A. Administer antipyretics for fever. B. Apply anti-embolism stockings. Carefully administer prescribed diuretics. D. Increase IV fluid rate rapidly. Answer. C. Administer prescribed diuretics cautiously. Question 4. Which task is appropriate to delegate to a UAP when caring for a patient in shock? A. Monitor for signs of decreased perfusion. B. Measure urine output hourly. C. Adjust oxygen flow rate. D. Administer IV fluids. Answer. B. Measure urine output hourly. Question 5. What intervention has the highest priority for a patient in anaphylactic shock? A. Initiate IV fluid bolus. B. Administer intramuscular epinephrine. C. Apply cool compresses. D. Insert a Foley catheter. Answer. B. Administer intramuscular epinephrine. Question 6. Which finding in a patient receiving dopamine for shock indicates the need for immediate action? A. Heart rate is 110 beats per minute. Blood pressure is 102 over 64 millimeters of mercury. C. Chest pain and ST elevation on ECG. D. Urine output is 40 milliliters per hour. Answer. C. Chest pain and ST elevation on ECG. Question 7. A patient with septic shock is confused and restless. Which is the nurse's priority action? A. Reorient the patient. B. Check blood glucose. C. Assess oxygen saturation. D. Review fluid intake. Answer. C. Assess oxygen saturation. Question 8. Which action is inappropriate for the nurse to delegate to a licensed practical nurse, LPN? A. Monitor vital signs every 15 minutes. B. Administer 4-dopamine. C. Assist with activities of daily living. D. Report changes in level of consciousness. Answer. B. Administer IV dopamine. Question 9. What is the best indicator that treatment for hypovolemic shock is effective? A. Respiratory rate decreases to 20 breaths per minute. B. Capillary refill time is less than 2 seconds. C. Skin remains cool to touch. Doctor-patient reports feeling better. Answer. B. Capillary refill time is less than 2 seconds. Question 10. The nurse receives a report on 4 patients. Which patient should be assessed first? A. A patient with distributive shock and a temperature of 102.4 degrees Fahrenheit. B. A patient post-fluid resuscitation with a blood pressure of 118 over 72 millimeters of mercury. A patient with anaphylactic shock who has hoarseness. D. A patient with cardiogenic shock and cool extremities. Answer. C. A patient with anaphylactic shock who has hoarseness. Question 11. Which lab value is most important to monitor in a patient with septic shock receiving antibiotics? A. White blood cell count. B. Serum creatinine. C. Hematocrit. D. Hemoglobin. Answer: B. Serum creatinine. Question 12. What is the priority intervention in the early stage of hypovolemic shock? A. Begin broad-spectrum antibiotics. B. Administer antiemetics. C. Initiate large-bore IV access. D. Prepare for blood transfusion. Answer: C. Initiate large-bore IV access. Question 13. Which patient is at highest risk for developing cardiogenic shock? A. A patient with long-term hypertension. B. A patient with pneumonia. C. A patient with acute myocardial infarction. D. A patient with a femur fracture. Answer: C. A patient with acute myocardial infarction. Question 14. What is a sign that a patient in shock is progressing to the irreversible stage? A. Bounding pulse. B. Decreased urine output. C. Confusion and agitation. D. Bradycardia and mottled skin. Answer: D. Bradycardia and mottled skin. Question 15. What is the nurse's priority when caring for a trauma patient in suspected hypovolemic shock? A. Encourage oral fluid intake. B. Place the patient in Trendelenburg position. C. Maintain airway and provide oxygen. D. Obtain a detailed health history. Answer: C. Maintain airway and provide oxygen. Question 16. Which action by the nurse is appropriate when managing distributive shock? A. Limit IV fluids to avoid overload. B. Administer vasopressors as prescribed. C. Elevate the patient's head to 90 degrees. D. Apply warm compresses to extremities. Answer: B. Administer vasopressors as prescribed. Question 17. A nurse is reviewing tasks for the day, which can be delegated to an experienced LPN. A. Titrate 4-norepinephrine. B. Monitor for signs of hypovolemia. C. Evaluate patient's response to fluid resuscitation. D. Educate patient about shock symptoms. Answer: B. Monitor for signs of hypovolemia. Question 18. What is a key expected outcome in the management of neurogenic shock? A. Stable blood pressure with vasopressor support. B. Elevated white blood cell count. C. Reduced intracranial pressure. D. Increased serum potassium level. Answer: A. Stable blood pressure with vasopressor support. Question 19. Which assessment finding in a patient receiving fluid resuscitation indicates a complication? A. Capillary refill less than 2 seconds. Blood central venous pressure of 16 millimeters of mercury. C. Heart rate 84 beats per minute. D. Oxygen saturation of 96%. Answer: B. Central venous pressure of 16 millimeters of mercury. Question 20. Which is the best indicator of tissue perfusion in a patient with shock? A. Pulse oximetry reading. B. Mean arterial pressure. C. Heart rate. D. Respiratory rate. Answer: B. Mean arterial pressure. Question 21. A patient in septic shock is developing respiratory distress. What should the nurse do first? A. Administer a bronchodilator. B. Elevate the head of the bed. C. Notify the respiratory therapist. D. Initiate mechanical ventilation. Answer: B. Elevate the head of the bed. Question 22. The nurse is caring for a patient in early septic shock. Which order should be implemented first? A. Draw blood cultures. B. Administer broad-spectrum antibiotics. C. Start vasopressors. D. Insert Foley catheter. Answer: A. Draw blood cultures. Question 23. Which change is most concerning in a patient with cardiogenic shock? A. Decreased peripheral edema. Bronchial pulmonary crackles with pink frothy sputum. C. Decrease in heart rate from 110 to 92 beats per minute. D. Decreased jugular vein distension. Answer: B. Pulmonary crackles with pink frothy sputum. Question 24. Which task is inappropriate to delegate to a UAP caring for a patient in shock? A. Providing oral hygiene. B. Assisting with repositioning. C. Monitoring level of consciousness. D. Recording intake and output. Answer: C. Monitoring level of consciousness. Question 25. What is the most reliable indicator that a patient in hypovolemic shock is responding to treatment? A. Respiratory rate of 20 beats per minute. B. Decreased anxiety level. C. Mean arterial pressure of 70 millimeters of mercury. D. Pale but dry skin. Answer: C. Mean arterial pressure of 70 millimeters of mercury. Question 26. The nurse receives new orders for a patient in neurogenic shock. Which action takes priority? A. Insert a urinary catheter. B. Administer IV atropine. C. Reposition the patient every 2 hours. D. Apply compression stockings. Answer: B. Administer IV atropine. Question 27. Which symptom requires immediate intervention in a patient with anaphylactic shock? A. Hives on the trunk. B. Feeling of impending doom. C. Audible wheezing and stridor. D. Anxiety and restlessness. Answer: C. Audible wheezing and stridor. Question 28. A nurse notes cool, clammy skin and decreased urine output in a post-op patient. What is the priority? A. Increase the IV infusion rate. B. Document the findings. C. Obtain an ECG. D. Notify the healthcare provider. Answer: D. Notify the healthcare provider. Question 29. What is the primary goal of fluid resuscitation in shock management? A. Reduce oxygen demand. B. Decrease cardiac workload. C. Restore tissue perfusion. D. Prevent electrolyte imbalance. Answer: C. Restore tissue perfusion. Question 30. Which order would the nurse question for a patient in cardiogenic shock? A. Start dopamine infusion. B. Administer IV fluids at 150 milliliters per hour. C. Monitor cardiac enzymes. Doctor, place the patient on cardiac monitor. Answer: B. Administer IV fluids at 150 milliliters per hour. Question 31. A patient in shock has a mean arterial pressure of 58 millimeters of mercury. What should the nurse do? A. Encourage the patient to deep breathe. B. Recheck blood pressure in 30 minutes. C. Notify the provider immediately. D. Place the patient in prone position. Answer: C. Notify the provider immediately. Question 32. A patient is receiving norepinephrine. Which nursing action is most critical? A. Monitor urine output every 4 hours. B. Use a central line for infusion. C. Assess pain every 6 hours. D. Check capillary refill every shift. Answer: B. Use a central line for infusion. Question 33. Which patient requires the most immediate assessment? A patient in anaphylactic shock who received epinephrine. B. A patient in neurogenic shock with a blood pressure of 88/50 millimeters of mercury. C. A patient in septic shock with a lactate level of 5 millimoles per liter. D. A patient with hypovolemic shock who becomes confused. Answer: D. A patient with hypovolemic shock who becomes confused. Question 34. Which nursing intervention is most effective in preventing complications of hypovolemic shock? A. Maintain normothermia. B. Strictly monitor electrolyte levels. C. Prevent fluid overload. D. Early recognition and treatment. Answer: D. Early recognition and treatment. Question 35. The nurse evaluates a patient with shock who has a CVP of 2 millimeters of mercury. What action is appropriate? A. Reduce fluid rate. B. Administer fluid bolus. C. Administer vasodilators. D. Prepare for dialysis. Answer: B. Administer fluid bolus. Question 36. What is the primary pathophysiological problem in cardiogenic shock? A. Systemic vasodilation. B. Decreased cardiac output. C. Blood volume loss. D. Capillary permeability. Answer: B. Decreased cardiac output. Question 37. What is the nurse's first action when a patient in shock suddenly becomes unresponsive? A. Call the healthcare provider. B. Check for a pulse. C. Apply oxygen. D. Raise the foot of the bed. Answer: B. Check for a pulse. Question 38. Which finding in a patient receiving fluids for shock should be reported immediately? A. Blood pressure increases to 130/80 millimeters of mercury. B. Crackles auscultated in bilateral lung bases. C. Urine output increases to 45 milliliters per hour. D. Heart rate decreases to 85 beats per minute. Answer: B. Crackles auscultated in bilateral lung bases. Question 39. A patient in hypovolemic shock is receiving blood. Which symptom indicates a possible transfusion reaction? A. Decreased heart rate. B. Elevated blood pressure. C. Flank pain and chills. D. Mild headache. Answer: C. Flank pain and chills. Question 40. A nurse evaluates 4 patients. Which one is at highest risk for developing shock? A. A patient with a temperature of 100.4 degrees Fahrenheit. B. A patient with severe burns over 30% of the body. C. A patient who just completed physical therapy. D. A patient with a stage 1 pressure ulcer. Answer: B. A patient with severe burns over 30% of the body.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.